your book, and I'll explain to you, you know, sort of like the thought process, even though they also explain it. Let's take a look at the left-hand page, though, 1016, and notice that metabolic acidosis is actually measured by milliequivalents of bicarb. If the milliequivalents of bicarb are too low, well, what's normal? They show you a normal here is running in between 35 and 45 millimeters. I'm sorry, that's the PCO2. The milliequivalent of bicarb is 22 to 26. So anything below 22 is not a good thing. That means that there could be too much acidity. Milliequivalents that are in too great a supply could cause metabolic alkalosis. In the respiratory situation, they have a normal range. And the PCO2 should be 35 to 45 millimeters of mercury is the partial pressure of CO2, the gas in the blood. Okay? So, and they tell you right away that respiratory acidosis is all about hypoventilation. Right here in the beige area, the brownish beige area. And that the respiratory alkalosis is all about hyperventilation. I've blown off too much CO2, so things have gotten alkalotic. So then we go through the little blue page here, and it says that students, particularly nursing students, and I can assure you that PA students and medical students and anybody who's dealing with acute care procedures is going to be hurt in this particular way, so I only want to hurt you a little bit here in lab, and then force you to memorize something that will not hurt at all when you get to the quiz, because you'll already know the answer. Okay, but I want you to think through it and actually select the correct answer, and maybe worry about it enough to think about it enough, right? So that it becomes totally clear to you. So let's go through here and notice that the first thing we're supposed to notice is the pH of the blood. Generally speaking, we won't know the pH of the blood unless we're checking our urine with a pH stick, or unless we're on the ICU, and probably a cardiovascular ICU, with an intubated artery. So only then will we know the actual pH of the blood. Nor will we really know what the partial pressure of CO2 is, unless we're in that situation. So the first thing we're supposed to check is pH. Is my patient acidic or alkaline? And I'm supposed to notice PCO2 to find out, well, could it possibly be because of respiratory mechanism? Now, of course, we've already dealt with one thing about respiratory mechanisms, where if I'm in a body cast and I can't breathe very well, I'm likely to be breathing too slow, right? Or if I can't get a breath by other means because of something like chronic bronchitis or pneumonia or something like that, there could be also a reason why there's a change in blood gases. Then we move on from that and we check the bicarb level. So we're going to check in this sequence. Okay. And so let's go to problem number 1 here. And problem number 1 says the blood value is pH 7.6. Uh-oh, out of range. There's even a chance that my patient is unconscious. Okay, so I'm probably in the CVICU, and I'm probably just having this monitored, right? And so I'm going, oh, look at that, pH 7.6. This is alkalosis. Then I go over to the PCO2. Oh, 24. What's normal? 35 to 45 is normal. Holy mackerel, this is out of range, right? And so it's actually too low. The PCO2 is too low. Wait a second. CO2 is acidic and I don't have enough, and I'm having alkalosis in the patient. Oh, that's the cause. My patient is breathing too fast and blowing off the CO2. Why would they be doing that? Well, because they're having an anxiety attack, maybe. Okay, now I'm looking at the next thing, which is the milli-equivalent of bicarb, 23. Oh, that's within range. That's normal. So what I'm suggesting here is that we have a short-term imbalance in the pH, not compensated as yet by the kidney, because it's short-term and it's probably a respiratory problem which will resolve itself. Analysis. Their analysis is the same as ours. pH is elevated, alkalosis, PCO2 is very low in cause, and that bicarb is normal. Therefore, conclusion, this is a respiratory alkalosis not compensated by renal mechanisms as might occur during short-term hyperventilation. Okay? So that's the deal. This person just apparently got some news that caused them to hyperventilate. Okay, usually it's a mental problem. They're thinking about them. Okay. Right. So, problem 2.